Okay, great. Let's get started. Thank you again, everyone, for joining. I hope everyone is keeping safe and healthy. This is actually our second webinar around COVID-19. In our first one, we covered the impact of COVID-19 on people's mood, looked more generally around communication, and also dives into a little bit around sort of eating habits. What's changing at such a sort of challenging and sort of unprecedented time like this. The focus of this week is going to be how it's impacting health routines, specifically looking at sort of over-the-counter healthcare. So, looking at medicines, medication, any medical supplies, and also sort of vitamins, supplements. We're also sort of going to dive into natural remedies and homemade remedies too, because we're seeing those come through quite a lot, especially in certain markets. So this week is healthcare. Every week we will be looking at different topics. So stay tuned, and please feel free to join. The session is also being recorded, so if anyone's team members, or if you've not been able to join this particular session, then we can also share the recordings with you. So I'll do a quick introduction first, for those of you who don't know me. I'm Vidisha. I lead the research and strategy team at Streetbees. More recently, I've been working on leading our human impact tracker. So I've been involved since the start in the design of it, and sort of now looking at delivering it, and also focusing on the output side and how we can best engage our clients with it. And I'd also like to introduce Kamal, who's presenting with me today.
Hi, everyone.
Kamal is the Global Strategy Director here at Streetbees as well. She's again been sort of instrumental in getting the COVID-19 Human Impact Tracker up and running, and she also has a lot of experience, interest and passion for the healthcare sector. So she actually been involved a lot in the reports we're writing as well. So that's why I wanted, Kamal's going to be taking you through the dashboard and the findings with me. So before we sort of dive in, some sort of housekeeping, you should be able to see a function that allows you to ask questions. So feel free to ask questions as we're going through. What we'll do is collect all the questions at the end and try and get through as many as we can. It's unlikely we'll be able to get through all of them, but so if we're not able to address your question today, we'll make sure we get back to you with an answer. Please also bear with us when it comes to the tech. We're still learning how to sort of deliver these digital discussions at scale. As I mentioned, there will be a recording available afterwards if needed, if there is any problems with the dashboard at all. So I mentioned we're going to be navigating through that dashboard as we talk through the findings. So it's going to be best if you're sort of using full screen and sort of zooming in. I've zoomed in as much as possible on my screen too, but do let me know, or do sort of raise if you're having any trouble seeing it. So I will get started now. So I'll sort of start, if you can see my screen, it's on the world map. It's showing actually the top moods. So we're asking people how it is, COVID-19 impacting, affecting how they feel, their mood. And you can see that this is the global breakdown of moods. So you can see there's a lot of anxiety, but actually in certain markets there is, light at the end of the tunnel, and the people are feeling a bit more positive. What the actual colours on each country are showing is the dominant mood in that market. So we see markets like US, where we see high levels of anxiety, as well as sort of UK and other parts of Europe. Where you look at sort of China, China's on the other side almost. It's sort of coming out of the more difficult situation, it's more stabilized now. So we can see the positivity returning there. And that's quite interesting. Some of the markets like South Korea and Japan aren't there yet, but we're seeing indications that soon their mood should also start turning, let's say, green and more so from anxious. before we go into the rest of the findings, it's important to know that the 10 markets we covered, for those of you who didn't attend our previous session, are sort of US, UK, France, Germany, Italy, Spain, India, China, South Korea, and Japan. So those are our core markets that you're seeing here. The study is nationally representative in these markets. So we are sort of reflecting the population in terms of age and gender. So one thing that we get asked is, are the sort of do emotions and fear levels really impact sort of people's behaviour when it comes to healthcare? I'm going to pass to Kamal now, and she's going to take us through some of that.
Thank you, Vidisha. So let's start by looking at the fear index and how it's been moving across the markets and how kind of it's changing as time is progressing. So if I explain what fear index is, basically we calculate it by kind of looking at percentage of people who are afraid of the current situation minus percentage of people who say they aren't afraid. Now, if you look at this fear index across the markets, we can clearly see that fear index, over time is going up, and especially if we look at the European markets and the US markets, where it has, more recently there have been many more cases being registered, there have been unfortunate deaths. We see that the fear index has exceptionally risen in these European and the American markets, while markets where the number of incremental cases have stabilized, such as China, we see that fear index is on its way down. Let's now look at how this fear index is really impacting consumers' purchase behavior when it comes to different categories. So again, similar to how we calculate fear index, we also have a purchase index. And what we really take here is that how much of consumption has really increased. So we are not capturing volume per se here, but what we are showing you is how consumer demand has changed across the different categories. So on this chart in front of you, you can look at category purchase index, which again is percentage of people who claim that they are purchasing certain categories more, minus percentage of people who say that they are purchasing certain categories less. Now here, of course, the essential items such as personal hygiene, cleaning, long-lasting groceries, fresh groceries have gone up. People have been panic buying because they are worried that they may not be able to get these essential items in the lockdown situation. And just next to that are the OTC categories. So we see purchase of vitamins and supplements, medical supplies, and medicines or natural remedies has also been increasing. And medical supplies, yes, we see that it's kind of more constant in the last week, but over the previous weeks showed that there was an increase in medical supplies as well. Now, we won't go deep into it, but I can certainly tell you from all the analysis that we have done that vitamins and supplements as well as the medicine increase is being driven mostly by UK and US, where we saw the biggest jump in fear indexes. So certainly there is some impact that fear index has on consumers' purchase behavior. So let's now deep dive into the specific OTC items. So which medicines is it that people are really buying more of? And here again, you can see that cold and flu medication, painkillers are sort of on a rise. People are now buying it more because they're worried in case they catch the infection. They need to have these medicines in their first aid box to be able to take them. We've also seen in a lot of open text data that people are talking about shortage of paracetamol. So we know that a lot of governments and WHO as well as social media has been talking about negative effects of ibuprofen, which is kind of making people turn to paracetamol. And this is also creating more anxiety because people are not able to find sufficient medicines in the dispensaries. The other interesting thing to be talked about on this chart is really around the masks. So the last few weeks that we've been tracking, OTC categories, we saw that masks were growing, largely driven by Asian markets. So we know that a lot of cultural, historical reasons sort of, have have made the Chinese, the South Korean, the Japanese consumers more comfortable in using masks. And we were seeing the increase when the fear index in China was up. But now with fear index coming down, we see that this usage is also on its down. This could also be, because of the fact that a lot of governments in Europe have requested consumers not to stockpile face masks, given the shortage of these masks to medical staff. In UK, for example, we can now see that NHS is facing a shortage of masks and equipment. So this could also be a reason why people are now becoming slightly more conscious and the masks usage is going down. So that's on the purchase index and purchase behavior within the OTC category. Vidisha, we saw that we can see here that natural health remedies are also on a rise, as well as the vitamins and supplements in the previous chart. Do we have any more detail on this?
Yeah, we do actually. So when we do dive into the different types of vitamins and supplements people are buying, as well as natural health remedies. So this first chart we're looking at is actually the natural health remedies that people are sort of saying they're buying more of. Here they're sort of looking at natural vitamins and supplements, but interestingly, over time, we're also seeing sort of the fruit and herbal teas, and actually quite a large increase in herbs and spices as well. So people are sort of going to what they have at home, as well as buying more natural herbal and Ayurvedic remedies over the counter too. If we take a deeper look at vitamins and supplements, which is this chart over here, there's been a huge spike in vitamin C, and that's obviously related to the recent, the media coverage around vitamin C. Multivitamins have also seen a huge increase. Interestingly, there are tests being run to see if vitamin C is actually effective in building immunity against COVID-19 or not. But that doesn't mean that people are going to wait. They're already jumping on the bandwagon and sort of increasing volumes. Actually, I'm going to show you some consumer quotes around this. It's not just vitamin C, but vitamin D too. I'm going to direct you to this consumer quotes here, where they're saying they're taking 5,000 units of vitamin D3 each day, as well as trying to eat as healthily as possible. Now, this person does already suffer from a low immune system, but I would have thought 5,000 units a day is probably a bit above the recommended dosage. So I don't think people are sort of paying attention to that very much. They're sort of increasing their volume and taking any kind of precautionary measures to sort of against the virus. So there is a huge opportunity here for sort of healthcare brands to better educate people on the correct dosage and warn of the effects if they're not used correctly. Because as we see, when anxiety and fear rises, people sort of start to take matters into their own hands.
Absolutely, absolutely. And perhaps there's also more opportunity to clarify side effects of the different home remedies that people are taking beyond these vitamins and supplements. So as this fear of coronavirus continues to escalate, we see many traditional cures and herbal remedies are also floating on the internet and in the health stores. People are putting their faith in different remedies, remedy ideas ranging from herbs, spices, flavored teas, to even animal waste, in an effort to boost their immunity against coronavirus infection. I saw this quote and it really stuck to me that what all can we do, what all things people get ready to consume just in order to save themselves. And so here you can see that, this gentleman, 27-year-old millennial, is talking about boil 1 liter of water, add 1 spoon of turmeric, 25 grams of ginger, blah, 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 blah. And he's also drinking 20 milliliter distillated cow urine, as it's considered to be a super immunity booster. So people are kind of doing everything possible, trying to boost their immune system and consuming things for which there's no evidence that they will be more effective. Rather, I would say that they're not kind of ignoring the detrimental effects also of these things, which, as you said, Vidisha, is clearly an opportunity for healthcare brands to clarify these age-old beliefs and educate people on, which sort of, even if they have to take sort of herbal home remedies, what sort of remedies they should really be considering or not considering at all.
Absolutely.
So that's kind of a lot on what people are consuming for natural immunity boosting. We spoke about vitamins, we spoke about supplements, we spoke about home remedies, and what we see is that the upward trajectory of this global pandemic is not really only affecting how people's consumption habits have changed and how people are physically feeling about themselves, but also their mental health and well-being. So we see that there is overall anxiety and stress levels which are elevated across countries, and now with people being locked down and fear mongering on the media and social media, as well as new cases of deaths coming across the world, people are getting more anxious and stressed and depressed. So you can see on this chart here, which Vidisha is sharing on her screen, that across a number of not so positive emotions, we have seen jump weeks on weeks. So we are seeing that people are more anxious, they are more bored, they are more depressed, they are frustrated with the lockdown and with the prevailing situations. There were also quotes where many consumers said that reading, listening, and watching news about the situation and vulnerable people makes them feel worse about the situation. And to overcome all of this, they do need support. We see consumers are kind of using health supplements to boost their immunity or fight infection, but they are not really looking actively at supplements to help them manage this stress, manage all of this anxiety, manage their mental health and well-being. And we believe this could again be a big opportunity for brands in healthcare space, how we can improve or increase the messagings around the products and maybe promote supplements which can actually help consumers come over these sort of emotions, or how leading OTC brands and medical associations can come up with ideas or campaigns to support mental health and well-being during these difficult times.
Yeah, it's really, really quite sort of interesting to see that some of the negative, we'd expect anxiety to increase, but sort of around the depression, obviously boredom sets in, people feeling apprehensive and uneasy. As that sort of increases, and obviously, some of these people are obviously under lockdown alone as well. And I think a lot of people right now are focusing more so on building immunity, sort of the physical side of it. So how do we fight the virus? How does our body fight the virus? But they're not really thinking about how they also need to care for their sort of mental health, and how they need to think about what supplements or what activities, what information do I need to ensure that my mental health is addressed during this time as well. And I think that's a really important area that sometimes is just, does get lost, especially with consumers at this time. Should we take a couple of questions now? And it might be a good time. So one of the questions we had is, what are the main sources consumers are using currently to get more information on the outbreak? So I'm just going to load that chart up. Just a moment. Okay, so looking at this sort of picture more globally, what we're seeing is the yellow is the usage and the red is the trust. So people are sort of mostly going to sort of social media, global news sites, local news sites, and also sort of government sites more often. But actually, social media and news sites are actually not sources they trust as much. So this is coming back to your point, Kamal, that people are going, can't help themselves from going to the media, to going to their social media as well as news sites, but then they're sort of getting scared, they're getting anxious, and they're not even sure whether they can fully trust this information. Whereas when it comes to sort of the World Health Organization, when it comes to sort of their national healthcare sites, the usage is lower, but relatively trust here, for example, is higher. So it's interesting that people are going to such wide sources without really fully putting their trust in them. But there is a role that health organizations and healthcare providers can play, because they are actually more trusted. People are just not engaging with them as much.
Absolutely, and this basically shows how important information is to consumers. This is once in a century kind of an event, and everybody is looking for information. People want brands to talk about how can they prevent this infection, what is causing this infection, what sort of measures they can take to build an immunity. But it's just about they don't really know what is the right source where they can find the credible information, and that's where a lot of healthcare brands can really play a vital role.
Yeah, yeah, I couldn't agree more with that. And actually, there's another question that sort of connects quite nicely, which is, what should we as sort of healthcare providers and healthcare brands be communicating at this time? I think we sort of went into this in detail already, but I do actually have a chart here on that too, which is sort of looking at what do people want to hear. We even asked what do people want to hear from a healthcare brand about coronavirus. And yes, you sort of have the effectiveness of it, how what effectiveness of their products in terms of fighting the virus, bacteria, germs, sort of how to prevent the infection. But people also want to know how to boost their immune system. We see that people are taking their matters into their own hands, sort of using coming across vitamins and supplements they believe to be boosting their immune system, but not actually taking the products correctly. And also when it comes to natural remedy, like they want to know about sort of foods that naturally contain these ingredients too, as well as the other practices they can be taking to prevent the other practices they can sort of start doing to prevent that infection too. So I think there's a lot beyond sort of efficacy that healthcare brands can be communicating. And I think like even sort of the general healthcare tips and advice, like small sort of tips, tricks, ways to sort of boost your health, keep your family safe, are things people are looking for, and that would help them engage with healthcare brands as well, and healthcare communications more, because we saw that they're actually going to be trusting them more as well. So that's something to watch out for.
Amazing.
I think we can take maybe one more question, which is someone's asked, how long have you been collecting the data? We actually started collecting the data in for China, US, and UK from the end of January. And then for other markets, we started adding them in. So Italy, we started adding in February as the situation there worsened. And then for markets after that, we've started a lot of them in March. So in the dashboard, what you find is that some of the data goes back, like fear, all the way back to sort of January, while other sort of data sources are sort of more recent and based in the last month or so.
Yeah, and that's why what really gives us the capability to kind of look at the long-term trends across markets and to be able to forecast what we have seen in markets which are ahead of all the other markets in the pandemic, how consumer behavior has changed or evolved in those markets, and then sort of take some learnings from there to tell our clients which of the observed trends are short-term abruption versus long-term category shifts. So, for example, if I talk about China specifically, we've seen that when this whole pandemic started, people were panic buying a lot of medicines, face masks, antiseptics, etc., in panic, and because there wasn't much information around it. But what we are seeing now is that the in that surge in OTC items has gone down drastically in China, and people are now kind of more gearing towards an overall healthier lifestyle, eating more fresh foods, better diet, regular exercise, and sort of taking good care of their mental well-being as well as health. Stockpiling, therefore, certainly is temporary, and OTC brands need to find their way to become more permanent in consumers' lifestyle, is sort of the big learning from all the trends that we've seen in China.
Yeah, I mean it's really quite interesting that something like we've seen that while vitamins and supplements also sort of made a were being consumed in China as well, and that's something that is likely to sort of continue as well, because culturally it's not as sort of popular as it is in UK and US markets and other European markets. But given that this is an ongoing health benefit, that they could, building up their immune system as opposed to sort of trying to take measures to fight it at the, sort of last minute, is definitely a trend. So that's why, it's a very good place to promote sort of ongoing benefits of vitamins and supplements, how they can fit into your day-to-day lifestyles, as well as sort of more natural remedies as well, that could consumers can sort of take with food, or add to their drinks, beverages. It's like we said, I've talked about teas, specific ingredients, and that would could quite easily fit into consumers' lives on an ongoing basis, even after this sort of initial sort of the panic and the fear phase, when this becomes the new normal.
Absolutely. Prevention is better than cure was never more truer than in the current state we are in.
Yes. Just seeing if there were any other questions. How do you collect the data has just come through. Yeah, that's actually a good point for those of you not familiar with our methodology. We are we collect data through a mobile app. So Streetbees is an app. We have communities all over the world, and we ask our communities to share with us around their experiences, their behaviors. And so not only do we sort of ask them more general questions, but a lot of the data we showed you from this was in fact from in the moment behavior. So, some of the charts we showed earlier around what people are doing were actually from more in the moment behavior as well. So we're trying to also understand, there's a lot of claimed stuff around, but what is the difference between what people are claiming to do versus what people are actually doing? So that's quite important for us too. We collect the data ongoing for our COVID-19 hit solution, and we sort of update our data in the dashboard weekly, so you can get sort of almost real-time insights as to what's going, and track it on a weekly basis. Because at this time there are actually shifts week on week. It's not sort of, some of these behavior changes are not happening in the longer term, they're happening week on week. So it's quite interesting to see that and keep the pulse on the consumers' changing lifestyles, habits and behaviors. Great. So let me sort of wrap up as there are no more questions and we're coming close to the end of our time. I just want to thank you all for joining us again. We appreciate that, you taking time out of your very busy schedules. I know I can imagine that it's been an incredibly hectic and difficult time for everyone. What we're really keen to do is we obviously have some webinars planned already, but we are really keen to hear from you what in categories or topics would be of interest to you. What would you like us to talk about? So please feel free to write in the questions or the chat box, and we'll collect all of that at the end of the session and then follow up. We'll also follow up with any other questions we weren't able to answer today, and we'll reach out to you directly because we will have your emails as well. So yeah, just to close, thank you again. Stay safe, stay healthy, and please do stay at home as well. Thank you very much.
Take care, everyone.